Thank you for taking the time to watch this video. We hope it can provide some important context about an important and growing part of the Canadian population. Canada's First Nations, Métis, and Inuit people often face challenges in the medical system. Dr. Alika Lafontaine is a University of Saskatchewan graduate in the field of anesthesiology, practicing in Saskatoon.
I think in particular, health professionals need to realize that Aboriginal people come from a different place than other non-Aboriginal Canadians. There's often a stronger link to community, and there's a stronger link to natural methods of healing. Health professionals need to realize that sometimes there needs to be more information, sometimes you need to answer more questions, and sometimes you need to have a more in-depth discussion with Aboriginal patients than you do from non-Aboriginal patients. And I think that's something that our healthcare system should be ready to accommodate.
I think that health professionals should have a greater sense that some Aboriginal people may choose to be conscientious objectors because they may just be hesitant to have their family immunized just because we have a history with, there's been smallpox, which has been in our community, with the flu pandemics that have affected our community, and the population was decimated because of that. And so, there's some beliefs that vaccinations may be used in a negative way in our community. And so we try to do a lot of education around that. But just to respect people's decision and try not to make people feel forced into a decision because they may pull away. And so we need to take time to sit down with people and respect their decisions.
This video is only a quick take on the issues from the perspective of 3 medical professionals. What we hope is that this can be a starting point for conversations about First Nations, Métis, and Inuit people in Canada's healthcare system. Dr. Isaac Sobel is the Chief Medical Officer of Health for Nunavut. He focused in the area of Aboriginal health, working with Métis, First Nations, and now Inuit communities.
What sensitivity do Canadian medical practitioners have to Aboriginal Canadians? Not enough. Not nearly enough. And that's true whether it's physicians working in Inuit communities, Métis communities, First Nations communities. I know that medical schools have started to include curriculum components to introduce Aboriginal health as something medical students have to learn. There's certainly not enough of that. There aren't very many physicians who have dedicated their careers to working in Aboriginal communities or with Aboriginal communities. So I'm sure that many Aboriginal people have had encounters with healthcare professionals they have found either uninformed or insensitive, and maybe sometimes even, frankly, racist. So I'm sure we have to do a lot more to improve the understanding and sensitivity and commitment of Canadian healthcare professionals to working with Aboriginal peoples.
Canadian medical professionals, they do a good job, and they've gone to universities and they've gotten all the degrees and information that they need. And even with those kinds of theory-based learning, there's some learning that you need to do as well, and that's about how to work with people and how to do home visits and how to work with Aboriginal people.
I think health professionals also need to realize that sometimes you need to have a more in-depth discussion with someone from an Aboriginal background in Canada. People often don't trust health professionals, and I think there's unique experiences within the Aboriginal community and their own experience with physicians and nurses that you have to be sensitive to and take more time, and that's what patients deserve.
But really it comes down to who are people comfortable speaking to. There are some doctors and nurses who don't speak plain language very easily, and patients could get uncomfortable talking to them. So not only could you talk to a doctor or nurse about immunization, but make sure it's somebody who you don't think is going to talk down to you or use words that are so big and confusing that you're going to be left with just as many questions at the end as you were at the beginning. I think number one, we have to train more Aboriginal health professionals. And many universities have started programs to provide space in medical schools, for example, and nursing schools, to have availability to qualified Aboriginal students. So that's going to be a huge change. And secondly, we need to have curriculum development in our medical schools and nursing schools about Aboriginal peoples and Aboriginal health.
I think vaccinations are really important in our community, especially the Aboriginal community. Before I was a nurse, I wasn't too sure because I don't think I had enough information to make a decision, but after now being in the workplace and being certified through the BC Centre of Disease Control to give vaccinations, I had that information. And you know, in our history as Aboriginal people, we've been so affected by different diseases like smallpox, like influenza and the pandemics that came through, and it killed so many of our people that, you know, we lost so many of our people that we need to protect ourselves through vaccine programs. And like things like flu, and the people that are most susceptible are children, babies, and elders, and we've lost so many of our elders. They carry our knowledge, they carry our languages and traditions, and we really need to have them as long as we can and keep them healthy. So protecting them against those diseases means vaccinating them.
So what I hope people take away if they watch this and kind of think about these questions in their minds is you actually take the time, because you're worth it, your health is worth it, and the health of your family at home is worth it. And if you don't have your health, you really don't have anything.
I'm Adam Beach, and this video was brought to you by the National Aboriginal Health Organization.